So I think we're now ready to go. On Wednesday, the 18th of March, we've heard that the university will be holding some sort of open forum seeking general input on the process of revising and updating the university's climate action plan. And that will be earlier in the day. My understanding is that it will not conflict with this class. So as we get an agenda and folks are interested in participating in that, we will share that with you. Clearly you have an interest in the subject of climate change and resilience. The university itself does as well, and some of you may want to weigh in on that on March the 18th as we get those details. And with that.
Thank you very much. Hello, everybody. I am Rebecca Riccio, the Jafali Family Director of the Social Impact Lab. Welcome to all of you who are watching online and here in the auditorium. I start every week by reminding us that we are building a learning community here that will hopefully translate what we're learning into action. So let's start, as we always do, by finding somebody you don't know and shaking hands and saying hello. Thank you so much. A couple of additional housekeeping points this week. I am not going to be here next week, but you'll be in good hands with Ted and Ava and Abby. And then the following week is our spring break, so we want to make sure that you don't show up and find the hall empty. So do come next week, but do not come on March 4th. And for people watching online, you get to watch Netflix or something that night. Because we aren't going to be here. We always put these up just in case you'd like to help others find us. The website where you can find information about the remainder of the semester and the resources that are available to you. Those are getting built up every week. That is a bit.ly address, NU Climate Course, and our Facebook address for the Facebook event is Climate Change Course FB. That will put you on the right Facebook page to watch the live stream. And we also have a YouTube channel where all of the courses are archived. So for folks who are new, you haven't missed anything, you can still watch it. And for those of you who know people who are interested in climate change, please make sure that they know those resources are available. On Thursdays, the Office of Undergraduate Research and Fellowships holds a lunch for us in appreciation of how difficult it is to be students at this time of climate crisis, studying this information, and so the lunch gives us an opportunity to come together and process. So if you haven't been to that, I encourage you to join us on Thursdays in Dodge. If you would like to RSVP, you can use that QR code and your cell phone to pull up the form and join us tomorrow. I also want to put this up again for those of you who might be interested in applying for the Millennium Fellowship to get the only UN certified, the only UN certificate in undergraduate leadership related to the Sustainable Development Goals. And if you have any questions about that, you can come by the Social Impact Lab and I'll tell you more. And I'm going to hand the mic over to my colleague, Laura Kuhl, who works in the policy school with me, because tonight we are turning to things global for the first time. So Laura, thank you for being here.
Great. It's wonderful to be here this evening and really looking forward to starting off our evening discussion on global development and climate change. As Rebecca mentioned, I'm an assistant professor in the School of Public Policy and Urban Affairs in the International Affairs program. And I want to start us off tonight by looking at the relationship between climate change and development and how climate change is going to impact poverty reduction and also how sustainable development can help us to meet some of those goals. And then leave us with some principles for adaptation, planning, and policy making in developing countries. So we know, and I just want to start off by acknowledging that people will experience the impacts of climate change differently around the world. And here we can see a map from the Intergovernmental Panel on Climate Change looking at flood exposure around the world and how that's going to increase under climate change. And you can see a similar phenomenon looking at hurricanes and tropical cyclones. These impacts obviously are important everywhere around the world, but they're particularly high exposures in developing countries. But of course, exposure is only one of the factors that makes people vulnerable to climate change. And poor people are more vulnerable to climate impacts for a variety of reasons. At a global level, we know that developing countries are more vulnerable than richer countries to climate change, but also even within societies, poor individuals are more vulnerable for a variety of reasons. First of all, there's higher exposure. Those previous maps showed some of that, but even within thinking at a smaller scale within a city, often the poor are located in areas of high vulnerability, like next to a river that's more likely to flood. They also face greater sensitivity to climate impacts. Often poor people are working in sectors that are highly exposed to climate impacts like agriculture. And they also have fewer resources with which to manage these climate impacts. This could be that they have less access to resources like insurance or social safety nets that allow them to build their capacity to cope with these impacts. The good news is that global poverty rates are declining. If we look from 1990 forward, we can see a dramatic decrease in the rates of extreme poverty around the world. Obviously, there's still a lot of work to be done to address poverty, and this is capturing only the most extreme levels of poverty, and there's still a lot of development that needs to be done, even for people who have graduated out of this very extreme poverty. But the challenge is that climate change will increase the number of people in poverty. I want to walk you through this graph in a little bit of detail. Here, this is an analysis done by the World Bank, and these are very rough estimates, so the details of the specifics aren't important. But what they did was model under high climate change scenarios and low climate change scenarios. So we don't know exactly how extreme emissions will be, how quickly we'll be able to address those. But we do know that no matter what, there's a certain amount of climate impacts that are already baked into the system. So we know that more people will be struggling in poverty because of climate change. But the question that I think is really interesting is looking at the first two scenarios that are prosperity scenarios compared to the bottom two that are poverty scenarios. And what this really is telling us is that if we are able to do development well, if we're able to spread those gains from development widely across society, then we can greatly reduce the number of people who will be negatively impacted by climate change. So the takeaway here is that it is through development and climate resilient development in particular that we can have a huge impact on addressing climate change. One of the ways to think about how to go about doing that is in terms of climate resilient development and how we make sure that the development strategies that we undertake are resilient to a wide range of climate impacts. I think it's really helpful to think in terms of the capacities that individuals might need, moving away from just thinking about individual impacts of climate change and thinking more holistically about all of those factors that create vulnerabilities for people. And this is a framework that helps us think about the different types of capacity that people might need as they manage climate impacts. We can think about coping capacities as those kind of capacities that allow people to manage relatively small shocks or stresses. These are often strategies that individuals are already employing and have been using to deal with climate shocks and stresses for a long, long time. Then there's adaptive capacity, and this is thinking about incremental adjustments or changes in the strategies that people are employing to manage medium levels of shocks or stress. And then we can also recognize that sometimes shocks or stresses are so large and so extreme that they're going to overwhelm the capacity of individuals to manage within that system. We need to start thinking about transformational capacities, or how we can actually move potentially to an even different system. So when we're thinking about how to go about development, we want to think about what are the existing capacities that people have already, and how can we do development in a way that can help to build those capacities, while also addressing the vulnerabilities, be them through the exposures that people face or the sensitivity of their lifestyles, their livelihoods to climate impacts. With that in mind, I now want to turn to a couple of examples from fieldwork that I've done in Honduras and Ethiopia, which are two very, very different contexts. And from those examples, draw out a couple of principles for climate adaptation policy and programming. The first principle that I want to talk about is building on existing strategies and experiences that countries have had and the successes that are already present. A lot of times when we think about climate change and when governments think about climate change, this is a really new issue. It feels very overwhelming. And I think it's really important to recognize that we don't have to start from scratch. There's a lot of experience and knowledge already in place. So this is an example from Honduras of an evacuation boat. In the late 90s, Honduras experienced a really extreme hurricane, Hurricane Mitch, and it really destroyed the country. But afterwards, along with a lot of support from others, the government has put in place a very well-established system of disaster preparedness and response. And this includes institutional structures all the way from the level of the presidency down to village committees. And so this boat represents a boat that's owned by one of these village committees that they use to evacuate the most vulnerable residents whenever there's an extreme event. And this is one strategy that can be used to help to adapt to some of the most extreme impacts of climate change. Similarly, in Ethiopia, there's a very well-established program, a Cash for Work program that has been developed in response to food security concerns in the country following the famine in the 1980s that Ethiopia experienced. And this is a huge program, and one of the things that's really exciting is a lot of adaptation projects are experimenting with how to build on the existing programs where people are doing communal labor to help build climate resilience. So in this photo, these participants are building structures that will help to address the landslides and erosion that are common in this degraded area. The second principle I wanted to talk about is that there's a lot of development work that's being done that, even if it's not directly addressing climate change, can help to build the adaptive capacity of the people that are participating. So here is an image from Honduras, and in the front is a farmer's field that has participated in a program that's helping them to increase their yields from maize through very simple practices like planting their plants closer together and in straight lines, rather than their neighbor that you can see in the back, that is planting in kind of more traditional ways that are more distributed. Obviously, if there's a drought, both of these fields will be impacted. But the resilience of the farmer in the front that's adopted some of these new practices is going to be higher because they've potentially been able to build up a reserve of additional maize that they can use to carry them through a drought. They might have been able to sell some of that additional yield and have some additional income that they can use to withstand a period of shock or stress. So again, this isn't a climate strategy in particular, but it's helping to build that adaptive capacity of households. Similarly, there's a lot of projects that are working on building alternative livelihoods or additional employment strategies, often targeting women, recognizing that having more sources of income for a household, particularly sources of income that aren't directly related to agriculture, can build that capacity of the household and build their resilience in the face of shocks or stresses. While development interventions can often help build resilience, it is important to recognize that not all development projects and interventions are necessarily climate resilient, and there can be tensions between development objectives like addressing poverty and resilience objectives. This was part of a project that was promoting vegetable production for smallholder farmers as a means of helping them get out of poverty, because you can make a lot more money selling vegetables than you can just growing stable crops. The challenge, however, is that this requires a large upfront investment. It's a lot more expensive to grow vegetables, and it's a lot higher risk. So if this crop were to fail, the farmer has lost a lot more than they did before taking on this risk. Also, vegetables are really water intensive. And so it's not always clear that this would be a long-term resilient strategy, depending on the conditions that are projected for the region. The next principle I wanted to talk about is the importance of public policy. A lot of times we can look at ways that individuals can adapt and strategies that individuals can undertake, but sometimes individual action is not going to be sufficient. So here's an image of a woman who was very proud of the work that she was doing, planting trees along the banks of this river to protect her community from flooding. But really, to be successful, this strategy requires coordination at a landscape scale and requires that a lot more people are engaged in this kind of action. It also requires that there be policies in place in terms of the development that's perhaps driving the flooding. In this particular case, there was a lot of dredging of this river to be used for construction, and that was part of the challenge with flooding. In Ethiopia, this is a great example of what is possible when there is this type of policy coordination. This image of terracing is part of that large public works program that I mentioned previously. And this image is of more than 10 years after these terraces had been put in place. This was a completely denuded landscape, very degraded in northern Ethiopia, that now is lush and is supporting a wide range of vibrant agriculture. There's springs that have popped back up. It's a real success story, but it did take 10 years. And it's often not in the time frame of individual investments and decision making to be able to wait for that kind of payoff. It requires greater coordination and public policies to support those kind of investments. The next principle I wanted to talk about is the importance of not letting the perfect be the enemy of the good. This is a water collection pit in Ethiopia that's being used to collect rainwater during short bouts of really extreme rainfall, and then can be used by the farmer to irrigate their land over long periods of dryness. And if we were to think about designing a technology to harvest rainwater, this is not what it would look like. A black pit that's open. is not an ideal technology, but black plastic is widely available in Ethiopia, and it's affordable for smallholder farmers, although it does often still require subsidies. And so this is a strategy, an adaptation strategy that's been widely adopted across the country because it's accessible. And so there's trade-offs to be made between strategies that are accessible and will actually be adopted and those that might be ideal under other circumstances. Particularly when we're thinking about supporting developing countries in their adaptation strategies as outsiders, it's really important to keep in mind what's culturally appropriate. Again, from Ethiopia, this is an image of a number of sheep grazing along the side of the road, and this has been promoted as an adaptation strategy in numerous projects because livestock are really important in the Ethiopian context. Ethiopia has some of the highest per capita livestock of any country in the world. But the challenge is that cattle are really drought intolerant. And so a lot of projects are promoting these smaller livestock of sheep and goats as a climate resilient alternative. And this has been wildly successful because it recognizes the cultural affinity for livestock in the Ethiopian context. Along the same lines, particularly when we're intervening in places that are not where we're from, it's important to always keep in mind the ethics of when is intervention appropriate and when might we actually be doing more harm. This is an image from Honduras of a coastal community that actually historically has built their homes on stilts because they live in a very flood-prone area. And this is a great example of coping capacity within communities. But I think at a certain point from a policy perspective, we have to ask, when is encouraging people to adopt strategies like this unethical? Or might this be allowing people to remain in place in areas that are potentially dangerous and unlikely to be inhabitable in the future? And when do we need to move from having the conversation about small incremental adjustments in coping strategies to the hard conversations of perhaps more transformational strategies like retreat? So with that, I'm going to turn it over to Erin.
Thank you, Laura. So my name is Erin Coughlan Perez, and I am the manager of the climate science team at the Red Cross Red Crescent Climate Center. And I'm going to pick up on most of the themes that Laura talked about with some perspectives a bit more from the humanitarian community. So the Red Cross is Red Cross and Red Crescent is a humanitarian organization that operates in 192 countries of the world. So every country has their own Red Cross or Red Crescent society. Here we have the American Red Cross domestically. Kenya has Kenya Red Cross. Somalia has Somalia Red Crescent, for example. And at the Climate Center, we are a distributed virtual team that supports the Red Cross Red Crescent and its partners, its humanitarian partners, in understanding climate risk. Why is climate risk important for humanitarians? A good number of the disasters we respond to are obviously climate related, with the exception of, for example, earthquakes. Earthquakes are not climate. And with the exception of, for example, conflict, right? Conflict obviously climate can contribute to some of the drivers of conflict, but we were really focusing on natural, what are originally called natural disasters that have to do with the climate. So talking about climate and development, first we've got climate change, right? This is a big issue because the risks that we understood existed in the past are no longer a good prediction of the current day risks and the risks in the future. So this is a big problem in the places where we work because people have set up their livelihoods and their lives in a way that is acknowledging a certain level of risk, and that risk has now changed. And so I'm one of the authors on the IPCC report that's going to come out next year. And one of the things we're looking at is how does climate change relate to risk management and how we do risk management in the humanitarian sector and how that relates, of course, also to development, which is not about responding to emergencies necessarily, but how we can progress and move forward in, of course, eliminating poverty, as Laura was saying, but also in providing lives where people have their needs met. And obviously this is defined differently in different ways, and inequality is one of the major questions of development, which we'll come back to a little bit later. So the intersection of climate change and development. What I'd like to emphasize here as sort of the major point of this talk is that we need to be engaging with change. Climate change is, of course, change, as is development. So what does the solution space look like at the intersection of these two major transformations that are happening in our world today? And so I'm going to leave you with three major ways in which we are trying to engage with change, three major categories in which this is happening, of course, among many, but I think there are three good and indicative ways of how we're looking at adaptation to climate change in the context of humanitarian work and development, of course. So the first is cities. Urbanization. This is one of the biggest trends of development, and this is a big one when it comes to new risks, right? So by I brought some statistics for you. By 2050, people predict that 75% of the world's population will live in cities. I live in a city. I live not too far from here, and I think probably a lot of us do too. Cities have become very attractive places to live. And what's very interesting is that on average, about 20 to 30 million people move from rural areas to cities every single year. In the developing world, that can look different than it might look here. And so in Asia, about 30% of people, and in Africa, about 60% of people who live in urban areas are actually living in informal settlements. And this is a big question, certainly for humanitarians, saying, what are the risks of these people living in these informal settlements? Informal settlements usually means you don't have tenure of your land, right? You don't own the land that you're living on. For whatever reason, someone is usually illegally renting it out to you or things like this, and you're not necessarily plugged into the services that the city can offer most of the rest of its residents. So informal settlements in urban areas are one of the key places where we're seeing change and we're seeing an increase in risks. So we did a study recently on heat waves and found that when people measure, this is very interesting. So like if you're looking at the official temperature record of New York City, where do you think the sensor is that is sensing the temperature of that city? Where was that? Yes, usually at the airport. There are a couple others. New York City has Central Park as well. But most cities, it's usually just at the airport. So what you find is very, very interesting. We started putting temperature sensors in different places in Nairobi and found that in the informal settlements, the temperature was higher on average than the official temperature of the city as measured at Jomo Kenyatta International Airport. And this is a big question about what are the risks to these people who are living in these new places with new risks, and how might that affect them, of course, as the planet gets warmer and heat waves get more extreme. So an example of a very large vulnerability is, a very extreme event that happened to a city recently is Cape Town. I don't know how many of you heard about Day Zero in Cape Town, which was all over the news a couple years ago. Yes, maybe. Between 2015 and 2017, there was very, very little rain in Cape Town itself, but also in the area where the aquifers of Cape Town are filled from. So the city was running dry. And actually one of the most fascinating ways that got public attention was calling this Day Zero. They calculated at what point would Cape Town literally run out of water. And they put a date. They said, this date is Day Zero. Asterisk, except if you do lots and lots of things to reduce water use. And guess what? The city did. Day Zero kept getting pushed back, and it got pushed back, and it never actually happened. Cape Town did not run out of water. The residents came together and, they cut water use to industry, to agriculture. People took crazy short showers. No one was using any water for anything. It was a very, very extreme time where the residents of the city came together and said, we can make this work. And they've cut their water use. Now their aquifers are filled, but they have definitely put in place some really interesting adaptations to try to maintain low levels of water use and different water management strategies. So as cities are growing, and as you have new risks and new vulnerabilities, we need to be looking at these adaptation options more seriously. We did a study for the Cape Town drought and found that climate change made it 3 times more likely that drought happened in today, or when it was, 2015 to 2017, than it would have in a world without climate change. So in the world of your grandparents. And that's today. That's not future. We live in a world with climate change, and in these places that are rapidly developing, we need to be talking about what kind of adaptation strategies we put in place, and in particular, strategies that take into account the needs of the most vulnerable people. So, theme number 2 for Engage with Change is going to be food production systems. And so you heard about this a little bit in Laura's talk. There's a lot that's going on. In the developing world, the production of food is changing rapidly over time, just like cities, right? So people are doing agriculture differently. People are managing land differently. They're using different crops. Networks for accessing, for example, smallholder farmers or pastoralists to allow them to sell their animals, for example, are increasing. So you can be more and more connected to a global market. So food production systems are changing. The climate is also changing. So at this intersection, we talk a lot about what does adaptation look like in agriculture and food production systems. And so obviously some of the big boxes are crop varieties. So there's a lot of really interesting research into what should you be planting, when should you be planting it, and where. And that certainly has motivated a lot of change over recent years. And technology for things like irrigation, for example. So how can you do irrigation well, considering your water availability in different places? And that has definitely enabled the transformation of a lot of different agricultural systems around the world. So how can we make choices, though, that don't increase our risk of having a shock and then we don't have any food because there was no rain or whatever? So theme number 3. Engage with Change is going to be the one that I work the most about, which is extreme events. We work in the Red Cross. Our bread and butter is extreme events. And so I'd like to show you a couple. Climate change is going to manifest and has already manifested itself so prominently in the form of extreme events, right? Many, many extreme events are becoming more frequent and more intense, and it's very clear to people that this is happening. And this is partly why the Red Cross is so vocal and so sees climate change as such an important priority, because it increases the number of extreme events that we need to respond to, and that's our job, is to respond to these events. So here's an example of what this looks like. If you can imagine the oceans, this is a figure from one of the recent IPCC reports that came out last September, the one on the oceans. If you imagine that, you've got a certain sea level that gets a little bit higher with different phases of the moon, or maybe, so every month it might, reach a high water mark. And then, every year or so you might get a bigger storm that might push the water up a little bit higher. And then about once a century, once in every 100 years, you might have an event that is very, very extreme. So this is the event of legends, right? This is the event of your grandparents that would tell you about this event. And so you can only imagine that the arrow going to the right is showing that we are starting to see these events of legends every year in different places, right? This is becoming an annual event, something that we need to be able to cope with constantly. So the IPCC said, okay, great, let's show a map of where this is happening. And instead they realized that that wasn't the right question to ask, and they have a map of when is this going to happen to you. So here's the map. You can see the colored circles are tidal gauges, and the darker the circle, the sooner it will be in which the event, the high sea level event of legends of 100 years will be happening every year. You can see this affects, the entire world, of course. This isn't just a developing country problem. Obviously, we live on the coast. I know you've talked about that. This is certainly an issue very relevant to Bostonians. And you will see there is a scarcity of good tidal gauges in a lot of the developing world. So we actually don't have good information for a lot of these places, which is partly one of the issues when it comes to climate change adaptation in areas with very, very little information. Not everyone has got the same amount of information about their projections for their region. So in the context of extreme events, one of the things that we work on, this is sort of the bread and butter of my work, is early warning systems. We're the Red Cross. We show up post-disaster, and the big question we have been asking in recent years is, can we show up pre-disaster to help get people out of the way? Can we use weather forecasts and other types of predictive analytics to understand who is likely to be at risk and to help avoid the impacts of the disaster before it happens? So within the humanitarian system, originally this wasn't possible, right? You know how it works. You get disaster. The Red Cross asks for money, puts an appeal out. We get money from governments. We get money from citizens. We say, hello, please, we would like to help these people who need help. We can see them. We can see that they need help. Please let us help them. And we get the money, and then we help them. That doesn't work if you have a forecast of a likely event. So if you have a storm that is bearing down on Bangladesh, we are not going to be starting to ask people, hello, we think there maybe are some people. And there really were no resources for us to be able to act in advance of a disaster. That has changed. So we've done a lot of lobbying over the last few years. And we've created a new fund within the Red Cross, and there now is a new fund for humanitarian NGOs called the START Network. And the UN is doing something similar to make money available based on a forecast of an event. And this is one way we are hoping that we can start to adapt to an increasing frequency and severity of extreme events around the world. So we call this forecast-based financing. And we write these plans in advance saying, if there is a cyclone bearing down on Bangladesh, we will use this money to get a whole bunch of trucks and help literally drive people away from the coast, right? That's one of our plans in Bangladesh. We have other ones that are, for example, a cash transfer for flooding to help people purchase the things that they need, et cetera, et cetera. So we're doing this all over the world right now and really pushing this as an adaptation mechanism. One hazard I'd like to just point out and underline when it comes to extreme events is heat waves. Heat waves are a silent killer. Heat waves, people die of, let's say, heart attacks more often during heat waves. And so it's not always clear that it was the heat wave that did it. People don't perceive that the heat wave is causing this excess mortality. You really, it becomes much more obvious when you actually just look at the statistics and show that deaths spiked during heat waves. Because there are no flooded streets, the mortality due to heat waves is often overlooked, including by humanitarians. And so this is a big risk that is increasing very, very rapidly, especially in cities, if we're talking about the intersection of that change agent as well. And something we are trying to push more and more about early warning systems for heat waves and just heat health systems so that when a heat wave is happening, we have places for people to go. We have volunteers who can go check on homebound elderly people, for example, and things like this. And so the last example I wanted to give comes back a little bit to what Laura mentioned about social protection systems in Ethiopia. If you already have a social protection system, like a social safety net, for example, that has registered all people over the age of 65 and can provide support to those people, could you scale that when there is a likely disaster? So could you reach those people and use the existing social protection systems to reach the most vulnerable and help them avoid disaster impacts when you do have such a forecast? So this is something we're working with. There are a few examples where this does happen in Ethiopia and Kenya, where they have successfully scaled up and out social protection systems based on forecasted drought, which was kind of exciting. And there's some hope that we'll be able to do things like this a bit more in the future. So those are my 3 engage with change themes. So I'd just like to close by saying that we did do a report recently on what we called what is the cost of doing nothing? So what is the cost of doing nothing about climate change if you think about it from a humanitarian's perspective? So what is going to be our burden in terms of responding to disasters and trying to help the most vulnerable people? And what we found underscores what Laura was saying earlier, is that, yes, climate change will increase this cost. But if we have unequal development and we have increasing inequality, that will increase the cost, the humanitarian burden and the humanitarian necessity even more. So in a world where there is high inequality and no climate change, we still have a huge problem. And obviously, in a world with high inequality and climate change, it's incredible. So one of the questions that we've been saying is, good development and development that promotes equality is one of the key ways that we can actually talk about reducing the need for humanitarian assistance and post-disaster response. So that's those are my 3 points, and I look forward to passing the microphone to you.
Hi, everyone. I'm Shan Mohammed. I'm a faculty member in the Department of Health Sciences. My background is I'm a physician by training in primary care, and I've been here at Northeastern for 13 years, really leading the Masters of Public Health program that focuses on urban health. And so my personal trajectory began as a Peace Corps volunteer in northern Thailand, where the impact of climate became very clear. At the age of 23, I left my small town of Ohio, and I worked with the Ministry of Public Health on iodine deficiency disorders. And I thought, my gosh, this is such a simple problem. We have iodized salt in the U.S. I know there used to be problems with goiters, but we just need to get iodine into the food system. But I quickly learned that issues are much more complex, and the issue that was being faced in Thailand was that there had been deforestation, and then there had been increasing monsoon rains. And what happened is the topsoil leached, washing the iodine that naturally occurred in the topsoil into the central plains of Thailand, where the iodine levels in the soil in central Thailand was 4 times the amount in the north. So even though people's dietary habits had not changed at all, the quality of food that they were able to eat was dramatically impacted by these human behavior changes and then weather-related issues. So I came from the perspective of clinical care and helping individuals, and then have now seen the light, and I am all in on public health. And so that's what I'm excited to share with you, is thinking about how do we think about public health, or how do we think about climate change, vulnerability, specifically in light to many of the health impacts that were alluded to in the previous presentations, and particularly from the vantage point of health equity. And so for me, I think there's 3 things that I want to impart with you today, is just understanding what are the specific health impacts. We've heard a lot of them, and I want to broaden our perspective as well. Understanding who's at risk, and we've already heard a lot about specific populations that are at risk. But then also hopefully leave with some hope about these cross-sectoral and interdisciplinary collaborations that potentially driven to address health concerns are actually going to improve global societies writ large. So to begin with, I always say we need to define our terms, and health means a lot of things to a lot of people. This 1948 definition from the World Health Organization is something that people are pretty familiar with. Health. It's a state of complete physical, mental, and social well-being not merely the absence of disease. So that was pretty good for 1948. We're not in 1948 now. We know people are living longer. We have a growing aging population. People are living longer with chronic disease and with disabilities. And so we need to expand our definition to understand health happens within a changing context. So it's this dynamic balance and equilibrium about how we interact and live our lives within a complex social and physical environment. And perhaps we really need to think about how do we help people adapt and cope and adapt and self-manage in different contexts. So if we think about what our health is like right now, we may say, hey, it's pretty good. I was able to get here to Northeastern today, or I'm watching on Facebook Live. I'm upright and I'm breathing. But perhaps if we change the context a little bit, we might not feel as comfortable. Maybe that's moving to some of the areas that we've seen in these earlier presentations. Maybe it's moving into a country where we don't speak the language at all, right? And so we begin to feel more vulnerable in terms of our abilities. So these vulnerabilities have lasting impacts. And so that's where the principle of health equity is important. And this idea, do we afford everyone the equal opportunity or the opportunity to achieve their highest level of health? And if not, what are those barriers? What are those exposures and the vulnerabilities that are impeding people's ability to be as healthy as possible? So from a public health perspective, the definition of public health that I love is what we collectively do as a society to assure the conditions in which people can be healthy. So it means that it's all of our jobs across disciplines, across sectors, to address these barriers to create a healthier society. And how do we know if we're doing a good job? It's usually with identifying these health disparities, which we're pretty good at identifying now, where we're seeing differences in morbidity or sickness or in death, just by virtue of age, race, gender, geographic location, etc. So we want to keep these things in mind, particularly as we think about these differential impacts of climate change around the world. So I mentioned how you might think about your health. And so the question is, what are the factors that went into keeping you as healthy as you are right now? Or maybe not as healthy as you want to be, but you're still pretty healthy. And if you think about those things, maybe some of the things that come to mind are these. Maybe it's good genetics, right? Maybe your mom lived to the age of 90 and your dad smoked a pack a day but still made it to 95, right? So maybe there's some genetic advantage that you have. Or maybe it's like, no, I've really made disciplined decisions about my health behaviors. It's what I value. I have the knowledge to enact those decisions or to make those decisions. I grew up in a family, perhaps, that really advocated and prioritized good health behaviors. Or it may just be my cultural practices. It could be that I have a great primary care physician who is on top of me about getting my screenings and my immunization and my flu shot. That's what contributes to my being healthy. Or it could be some of these social and environmental factors that we have less control over that influence where we've been born, where we live, where we're growing, where we're working, etc. And so this final component of the social and environmental factors within public health are talked about as the social and environmental determinants of health. We can also begin to think about corporate determinants of health as well, because we realize that when we are thinking about our social and environment, the environments that we live in, a lot of it is influenced by corporate practices and policies. So let's just think about how healthy you are if you have differential levels of employment, your income, etc. Or depending on the quality of the housing that you live in, how safe you feel. Are you able to go out? Do you have beautiful green space that helps you relax? What about your education level? Did you complete the 8th grade? Did you complete high school? Do you have advanced training? What other informal level of education or informal education have you been privy to? What about just access to food? We talked about food security, right? And thinking about how connected am I with my social support? So these are the pieces that, from a public health perspective, we say, how can we mobilize policies and programs to support people to the greatest level to have them have good health outcomes? And finally, healthcare. We know that all these things are important. People tend to prioritize healthcare and the healthcare system as being more important, but in actuality, in many cases, it's not nearly as important as some of these other components that we've talked about. So we know that these drive health outcomes. And so if we think about what are the impacts of climate change across these social and structural determinants, that's one thing to think about. And depending how resilient we are by virtue of our social and environmental determinants of health, that may impact the ability to adapt and to cope. So I just want to flip through a few things because I love maps. And this is what public health, and I think where the promise is in terms of diving more deeply into a sophisticated understanding of what responses we can come up with. So when we think about social determinants, here's just the US. We can say, yes, it absolutely varies here by county, which gives a much more sophisticated look than up in the upper right-hand corner, which is just at a state level in terms of what percentage of the population is living below the poverty line. If we look globally, we can do this same thing, right? So this is even before thinking about the impacts of climate change. It's just how resilient are we, and where do we need to be thinking about attending to sort of, Erin, your comment about how do we identify and sort of try and forecast where are we going to need, where's the need going to be the greatest in terms of some of these responses. You can also think about schooling, right? So here's a map that shows percentage of the population that is over the age of 25 that doesn't have a high school diploma, right? Again, if you just look at the upper right-hand corner, you may make some assumptions looking across states, but when you have a much more sophisticated level, detailed level at the county level, new ideas emerge in terms of how would we mobilize strategies to support individuals to be more resilient. We can do the same thing looking at enrollment across the world in secondary education. This is the reverse, so it might throw you off. We're looking at the lightest colored, have the lowest percentages of students enrolled in secondary education.
Hello.
Hi.
Hello, hello. Hello?
I'm going to keep going. Can you hear me? I think they're just checking. So, and then we can do it in terms of healthcare. Here we look across the United States at access to primary care physicians. And again, we can see that there are areas that have greater coverage, areas that there is less availability in terms of primary care services. If we try and take a look at this globally, we can look at universal health coverage and really think about, if you look at the bottom line here, this service coverage index, a concept that says needs are different. It's not just about primary care services, but thinking about reproductive health services, maternal, newborn, child health, as well as infectious disease, non-communicable diseases as well. And we can see that there are certain areas of the country, of the world, that are potentially at greater risk. And so if we begin to think, how do we take this data and map it on to some of the data that Erin showed about where these events are likely to occur, then we're like, holy cow, now we maybe can begin to prioritize and think about how we structure our interventions and our policies and how do we mobilize our resources. So this is not going to be a surprise because you've talked about this a lot. We know that climate change has a variety of impacts. They are listed here, and we're going to take a closer look at these, particularly as these differentially impact different populations. The vulnerability, and I'll go quickly here, is this idea, right, that if we have amazing resiliency through our social determinants of health, then maybe the exposure will have differing effects on us by virtue of our duration of exposure, and then are we sensitive to those, right? So this goes to similarly to the idea of heat waves, and we'll come back to that at the end. Who does better in a heat wave than other people, right? So obviously people with cardiovascular disease, we heard, are at greater risk, but also the elderly, children, et cetera, those who don't have air conditioning, et cetera. And so we're going to want to think about this adaptive capacity component of how do we think about these cross-sectoral collaborations and institutions that can help us be less vulnerable to the health impacts of climate change. So we know that there are distinct populations that we need to think about. Keeping in mind, just from de facto where people start from with their social and environmental determinants of health. Children, pregnant women, elderly, we can think about. Those with disabilities, pre-existing conditions, other vulnerable populations, low income or occupations. So this idea of it may be, if you are doing more work outside, if you are doing more work in terms of fisheries and agriculture, right? The exposures that you're likely to be exposed to. And then the idea of other vulnerabilities, and particularly going to the piece of what can states and organizations do in terms of strengthening healthcare systems and public health infrastructures. And that's where I'll come back to at the end of our talk. I'm really making a strong push for enhancing our public health systems. So there are 8 broad categories. We've kind of talked about these, so I just want to highlight the idea of why people, or who's vulnerable, right? So we know we have these extreme heat events, but are we thinking about those who are working outside who may be healthy aged, right? Are we thinking about student athletes? Are we thinking about other people who, by virtue of their resources and their work life, are more vulnerable or not? We can also think about floods and droughts, and we've talked about this. If we think back to Hurricane Katrina, for those of you who were aware of that, that was tragic, right? When we think about what the impact was for people who didn't have elevators, who were wheelchair bound, who didn't have evacuation routes available to them, how do we think about them? And the flip side is the droughts, and so we've talked a little bit about that in terms of stressors. I think the main thing that I want to highlight here is that, unfortunately, it's getting worse in some areas, and the other impact that we need to be thinking about is the migration that will happen, right? We've talked about the rapid growth in cities and informal settlements, and then what will happen based either in coastal areas or with water scarcity, how people will be forced to move, and what does that mean for social stability? With air pollution, we know that those with respiratory diseases are at risk. We see increasing rates of asthma and allergy, but also cardiovascular disease. More and more studies are coming out in terms of the impacts of these very small particulates that actually pass right through the lung tissue into the bloodstream. And so this reason for heart disease, other diseases are now being tied, or worsening of other diseases, including anemia, things like that, related to small particulate matter. And when we think about where is the worst air pollution in the world, here's an example looking at particulate matter across the world. Again, this idea of how do we think about this? Some of it may be more natural. We think about dust, right? But then the idea of what happens in our urban areas with air pollution. And then there's the issue of changes in vectors of disease. So ticks, mosquitoes, rodents, et cetera. And how does that change over time? Because with the change in temperature, change in humidity, et cetera, there's migration of these vectors. And so here's just an example. It's a little hard to see, but the most important thing is in yellow is where malaria currently is in terms of the distribution of the Anopheles mosquito. But then with the red, by the year 2050, with changes in temperature and changes in habitat, the expectation that the malaria-carrying mosquito will expand to these other regions. And this has been documented around the world. We can look at the growth or the spread of tick disease in Scandinavia, for example, with changing temperatures as well. So it's not an uncommon finding. Then we have to worry about contaminated water. This can happen through flooding. So whether the salt water gets into our natural aquifers, whether the salt water gets and floods toxic sites or corporations and then contaminates the water with toxins. So we need to think about who's vulnerable. And so that can be people obviously living along the coast, but interestingly enough, the idea of how are we dependent on our food sources? So we begin moving into, individuals who are dependent on fish and shellfish, either for their dietary consumption or for their economic consumption. And here's an example just looking at the spread of cholera. Actually, it was Hurricane Mitch that had a tremendous increase in cholera following that. But here's just globally looking at what was once relatively well controlled in terms of cholera, and over time how we've seen the spread of cholera. And then contaminated foods. There have been studies in Australia that have looked at increasing temperatures and the corresponding increase in salmonella and other food poisoning. So this idea of how do we keep our food supply safe? How do we keep that food that needs to be refrigerated, appropriately refrigerated? So we need to be thinking about that. And this idea of anyone, again, with chronic diseases, weakened immune systems, again, being vulnerable to those impacts. And hunger and malnutrition, again, this idea of what are the impacts on our food supply affecting our traditional at-risk individuals, infants, young children, pregnant women, etc. And here is just another global map looking at percentage of populations who don't have access to adequate nutrition, again, just to help us be thinking about where do we begin to prioritize our efforts. And the last key component that I think is critically important and under-recognized and under-treated is mental health issues. So we can think about those who have been impacted by extreme events, but we can also think about those just impacted by the threat of extreme events. And this idea of whenever there's a threat to our social well-being or our economic well-being, and how are we as a society going to create these cross-sectoral collaborations to help address those. These maps are a little misleading, but they're basically what we have, and I believe, Erin, you were talking about the lack of information, and this is so important, right? So how do countries report on mental health issues? Is it prioritized? Is it a recognized diagnosis? Do we have systems to capture data? That becomes an important part. But here we can see, sort of, not surprisingly, a differential distribution of depression. And then next we have anxiety disorders in terms of prevalence as well. So this probably is the take-home slide that really puts it all together, thinking about how is it that climate change globally is going to have health impacts, and how our public health systems and healthcare systems and governments and non-government organizations, how are we going to come together to address all of the issues and illnesses and impacts in the periphery of this? So just to close up with some hope is what's been happening? What are we trying to do from a public health perspective? The Center for Disease Control has the BRACE framework that is being implemented, so building resilience against climate effects. Not surprising, it has multiple steps, but it starts with what we've been doing. Sort of, how do we anticipate climate impacts? How do we assess who's vulnerable? How do we think about what the burden might be? How do we rethink our interventions, our collaborations, our efforts? How do we build out a plan if it doesn't already exist? And how do we maintain a robust system to evaluate the impact of these programs, policies, services? I want to give one example of how this gets operationalized. This is looking at heat vulnerability in Georgia. So it's not international, but I think it's a great example where these researchers began to compile all of this information. So here we have by census tract, percentage of people living below poverty, and then we're thinking about who else might be vulnerable, would be, percent of individuals 65 or older who live alone, where are they? Just looking at heat maps and where do they tend to be higher temperatures in a given geographic area? And then we combine that with this data about patients receiving dialysis. So we know that in this case, patients undergoing dialysis are particularly at risk around heat-related events, and so where are they? Then they come up with a hospital insufficiency score, but just this idea of access to care services. Right? So where can you go? How do you get treatment? And then finally, looking at impervious surfaces. So this speaks to the heat island effect that we heard about. Where is temperature more highly focused? So you can see Atlanta sort of having a great percentage of impervious surfaces. And when you pull all these things together, you get a cumulative or a composite vulnerability map. And so this can be used then by agencies and organizations to strategize about where do we begin to think, if and when this happens, how are we going to need to mobilize our services? So, and programs and policies. So it's not a precise science, but it's a really interesting thing about when we invest in public health organizations and we have the data that we need, we potentially can be much more efficient with our resources and increase health resilience from an individual and a community level. So the goal is not just to mitigate the damage, but to heal, and the belief that if you build these things, you actually have a better society, right? So it's not just about after the fact, it's if we can build these things, we're gonna have a society where people can thrive. And how do we think about our unlikely partners in this? It's not just physicians, it's not just nurses, it's not just the public health department. We talked about mentioning, the climatologists. How do we think about working with our urban planners, with our wildlife, wild land management folks, et cetera? Right? So we really need to think broadly about that. And how do we leverage our expertise and promote positive outcomes? And particularly in these 5 areas that have been studied. So improving our health systems, we've talked about that. Organizational resilience, between organizations and within organizations, social connectedness between people and organizations, psychological resilience, and then always remembering who already, before these events happen, are some of our most vulnerable populations. So that's how I think about health equity and climate change and where we need to be attending to, and creating some frameworks that help us think about where do we go from here, given all that we've heard about the challenges, the idea of where do we put our development, where do we put our emergency services. So thanks very much, and I will hand it off to Ava.
Hi, my name is Ava. I'm a 4th year environmental studies and international affairs student, and I was lucky enough to be able to attend the climate negotiations in Madrid in this past December.
Hi, everybody. My name is Keyon Rostamnezhad. I'm a 4th year international affairs and economics major. I also had the summer opportunity, so we're going to talk about that today.
Yep. So I wanted to call back a little to our cartoons from last week. I thought this cartoon is pretty great, outlining all these wonderful co-benefits to addressing climate change, and the white man from the audience saying, what if it's a big hoax and we create a better world for nothing? So I think that is a good way to start off. I'm gonna start with a brief overview of some of the most important conferences over international climate action, and then Keyon's going to talk about some of the more recent developments that have been happening, and then we're going to share some anecdotes from when we were at the climate negotiations. So starting with Stockholm, which was in 1972, this was the first UN conference concerning environment and human interactions as an entity that was working together. And it was starting this idea of connecting also environmental protection and development, instead of being a dichotomy, being able to include both of these dynamics together, improving the environment while also promoting developing countries. And so we fast forward to 1992 is the next big international climate convention, the Rio Earth Summit. And this was really important. It created the United Nations Framework Convention on Climate Change, or the UNFCCC, which is the framework for every other agreement that came after this point, including the Kyoto Protocol, which we'll get into, and the Paris Climate Agreement. And it also introduced the concept of sustainable development. So continuing along with this idea of connecting environmental protection and development, and having economic development that doesn't compromise the ability of future generations to have the same level of resources as our generation is able to. So this really sets the stage for modern climate negotiations. And then we go to Kyoto, which was signed in 1997 but did not enter into force into 2005. And so what entered into force means is that typically with these protocols and treaties, there's a certain benchmark of countries that have to sign onto the treaty in order for it to begin action. And typically also, in this case, there was a percentage of emissions that needed to be accounted for in the countries that have signed. So you can't have a bunch of really tiny countries that aren't contributing any or very little to climate change. You need to have some of the big players to be involved. So that's why it took such a long time from the time that it was signed to 2005 when it actually entered into force. And so Kyoto had a top-down approach, meaning that it set a global cap of emissions for all countries, and then it set individual caps for each individual country. It also introduced this idea of common but differentiated responsibilities, or CBDR. So this idea that all countries are contributing and thinking about climate change, but there are different expectations for developed and developing countries, as developed countries are the ones who have historically contributed to climate change, compared to developing countries who bear the brunt of the impacts and contributed the least. So with Kyoto, only developed countries were required to have emissions reductions and had these caps, which was a large portion of why the U.S. never ratified it. So the U.S. signed Kyoto, but it was never ratified by Congress, which is a large reason why it's failed. As you know, we're one of the largest emitters of carbon. So to not have the U.S. be involved in a protocol about climate change pretty much makes it pretty hard to attack the problem globally. So as you can see, it pretty much had the entire world in it, but just the lack of the U.S. and also Australia made it pretty difficult for it to be effective. So then we moved to Paris, which completely turned the Kyoto model on its head and has this sort of bottom-up approach. So it has this goal to keep an increase in global temperatures to well below 2 degrees pre-industrial levels, and had pursue efforts to be below 1.5. So you can see that kind of negotiated language in that goal. And then every country has to have a nationally determined contribution, or an NDC, which will be reevaluated every 5 years. And so these are really flexible. There's no requirement for what country every country needed to reduce. It just needed to be the most ambitious policy that the country could possibly have. So it leaves a lot open, which was very attractive to most countries that didn't want to have this very restrictive cap. Also, there was no written difference between developing and developed countries in terms of these NDCs. And it also, because of the way this treaty is framed, it didn't have to be ratified by Congress. So you can see all these changes in the Paris Agreement compared to Kyoto, basically accommodating the U.S. so the U.S. would sign and it could be effective. But because that it didn't have to be ratified by Congress, our signature on the Paris Climate Agreement acts as sort of an executive action, which makes it pretty easy, or easier, for a president to withdraw, as we have seen. So also there's this idea of developed countries needing to support developing countries through finance and also technology to support adaptation and mitigation. Again, this idea of developed countries being the largest contributors and developing countries bearing the brunt of the impact. So as you can see from this picture, it was a very exciting time. People were very happy that all these countries signed on. They were able to get a good to agreement. Very positive and ambitious plan, and I'll pass it on to Keyon to see how that panned out.
Thank you. So yeah, where we basically left off, I just want to focus on this picture. is that many people are cheering. The world has now approached this as a huge sigh. Paris, COP21, this was in 2015. Everybody had a huge sigh of relief that we did it. You know, we aspire to 1.5 degrees Celsius. We're going to reduce the rise. Everybody was extremely happy. But to move on to the next slide, I just want to put in perspective what's actually going on. So if you take a look at this picture, it kind of forecasts where global temperature rise is going to reach by 2100 in a few scenarios. Now, having signed the Paris Agreement, everybody had committed to what you see as that big arrow. That's where we are, and right above it, you see a 1.5 degrees Celsius Paris Agreement goal. That's what everybody aspired to. That's why it's in green. It's a target that is reachable, that we think is okay. And that's what was negotiated in 2015. But then if you bring your attention a bit higher, you see three scenarios that are kind of the status quo, the reality of what's actually going on. Now, the first one to the left is pledges and targets. This is in the scenario that we've adopted the Paris Agreement, we have this huge bottom-up approach, and now the takeaway is we're going to implement the policies that we've decided to do so far. Unfortunately, you see a huge gap, and in our best-case scenario, with those pledges and targets, we'd still have a 2.3 degrees Celsius rise. That seems a bit ironic. We just committed to 1.5 degrees Celsius, yet we're going to have a 2.3 degrees Celsius rise. That's with pledges. If we were to stick with our current policies and we continue going on, actually on average, we're going to reach 3 degrees Celsius in a temperature rise. Now that's double what we agreed to, and obviously very concerning. And even in our most optimistic policies, you can see that we're still somewhere around those pledges and targets of 2 degrees Celsius rise, and we're above it. So the question is, what happened? Where are we? And I think the next picture might kind of explain that. To put in perspective again, we signed the Paris Agreement, and we pledged that each country was going to commit an INDC, NDC, a nationally determined contribution. And if you look here, the countries are basically categorized into what they've actually done in that INDC. Look all the way to the right. Those are our role models. Let's congratulate them. Oh, wait, there's no countries there. That's a big concern. There are no countries that are limiting their degree Celsius rise to 1.5. That's extremely concerning as island states push for this. In our best case, we have close to compatibility with Morocco and the Gambia, which is great. But then if you bring your attention all the way to the left, this has been the big concern. Now, Paris has been signed, but countries who were sort of just going along with it are many, and they've decided that they're going to take this approach and sort of keep things as they are. Now, that threatens the strength of the Paris Agreement, and that puts into question whether or not we're going to get things done. So I think that moves us on to what the future looked like in the past few years. I've had the privilege with Professor Kuhl, with Ava, with other students to attend various COPs. And since Paris, the goal has now been to implement what the Paris Agreement was and really to take all these ambitious, cheering goals and turn them into action. So the first one I want to talk about was 2 years ago, or the COP right before we went to. This was considered the last year to sign a workbook for Paris. The Paris workbook is what they call basically the ways to implement that agreement. It was in Poland, and some of the key themes were those growing pains that we all considered. There's a reason why that we don't have those optimistic targets below 1.5 because of things like a just transition. That's a phrase that many used to explain that in order to actually get to that 1.5 degrees Celsius, you need to include communities who are labor communities, all different sectors who need to have a say in this. And that dominated the conversation throughout COP24 in Poland. Whether that was good or bad remained to be seen. Many people saw it as good, but that did potentially slow the process, and people raised the question of how are we going to get this done if we're going at this pace? That obviously led to then activist demands. It was very activist-driven. You had students and you had young people standing up. This was the first year that those famed student activists and young leaders rose to the occasion and said we need to go farther, that Paris needs to be the target that we are reaching now. And the final thing that really happened that shaped that conference was that the U.S., who Ava mentioned a bit, was pulling out of the Paris Agreement, as we know. Unfortunately, it made headlines everywhere with the president who had taken office. As soon as the U.S. pulled out, these conferences were now dominated not by a U.S. who said we want to make changes, but by a U.S. who said this needs to stop. And that changed the conversation. Now the U.S. was pushing back on things like the IPCC's report a report that the IPCC created for the people of the conference, they pushed back and wanted to change it from welcoming to noting, which is diplomatic terms of saying we don't care. And that was obviously a big challenge. So that confused many because that was supposed to be the year that we got it done, that we finished. And so we moved on to the last year, which was COP25. This was probably in the news as well. It moved many times. It was supposed to be in Brazil, and then unfortunately was moved to Santiago, Chile. And then at the last second, unfortunately, and in keeping with what was going on in the world, some protests and changes that are social movements led to Chile not being able to host. And that moved it again to a European country like Madrid, Spain, having to host this conference. That changed the entire vibe. Unfortunately, a COP that was supposed to be focused on Sustainable Development Goal 14, a blue COP, changed. It no longer could be talked about because there were so many strong pushes for dealing with very, very concerning new developments. So at this point, the U.S. had formally withdrawn, or they said they had, and now there really were just stonewalling negotiations. They were criticized to the last day, but unfortunately that didn't change. And I just referenced the fossil of the day because that was a really fun activity that they did every single day at the end of the conference, that activists did, to basically give awards to the countries that were the worst emitters, that were making the worst progress. And unfortunately, the United States and Japan and Norway and a few other countries kept making that list. So the press was all over this conference, but unfortunately the last few things I put reference what had to actually get done. This was a year to just wrap up all of the changes that COP24 unfortunately couldn't fix. That was talking about carbon markets, talking about increasing those NDCs, like I mentioned. Those are supposed to be revived and made stronger this year, and that conversation couldn't happen. So as you would expect, there were many protests, and unfortunately people were even expelled from the conference, brought back. The headlines were not good, and that has sort of changed the tone away from those handshaking Paris excitement and towards deep concern about what the state of international negotiations is. So the takeaways from this, we just wonder, are whether or not NGOs are actually going to be able to play a role in these conferences, whether or not youth and independent organizations are going to actually get to have a say if the conference goes like this, whether or not COP, the Conference of the Parties, is even the right place to be having these talks anymore, whether it's threatened by countries blocking these propositions, whether independent summits could be the solution. All of these have raised major concerns. And the final one is young people. Are they being empowered like we think they are? Are they really leaders of the movement? Or have countries just tokenized youth like Greta Thunberg as a way to achieve my equivalent of brownie points or get attention, but not actually take action? So we'll leave it at that, and we'll just reflect a bit on some of our experiences. But that's kind of the state of where we are right now coming into COP.
Yeah, so just one more cartoon to leave us on that really reflects some of my feelings upon leaving COP. It's settled. We agree to sign a pledge to hold another meeting to consider changing course at a date yet to be determined, which is unfortunately a lot of the rhetoric that occurs at COP. A quick anecdote, I attended a lot of the Article 6 negotiations at COP this year, which was pretty much the biggest thing that needed to be negotiated. And for a full hour of negotiations, countries were deciding whether or not they would call the meetings they were going to have the next day bilaterals, multilaterals, or informal informals. And they landed after an hour of negotiations on get-togethers. So, and this is the most important thing to be negotiated at COP. And that was a full hour of what we were talking about. And you can feel the frustration at COP of the NGOs and the nonprofits and the citizens and the youth that are there demanding change, looking at the IPCC report saying we have 12 years to address climate change. And not to undermine how amazing it is that we can get all the countries in the world to agree on anything. But when you have an issue like climate change that is so urgent, we can't wait, how are we having conversations? Article 6 wasn't even negotiated at COP, and that was a year delayed already. So now we're 2 years, still have no decision on Article 6, which is carbon markets, which has the ability to undermine a lot of what Paris is trying to accomplish. So maybe on a more positive reflection of COP.
Yeah, my brief reflection from COP is a bit more optimistic. I think I spent a lot of time seeing NGOs, independent groups, If any of you have heard about it, the We Are Still In coalition was very popular at the conference because it was the rest of the U.S., basically states, cities, leaders who wanted to say that we're stepping up. They came and took actions. They came and made partnerships, and they came with purpose. And I was very excited to see that. That kind of inspired me, and that I think inspired a lot of other young people or people who are making progress on climate in spite of, hopefully just despite, but sometimes in spite of people's actions. I think the takeaway is whether or not it's a COP, it needs to be done and the problems need to be addressed, and people are now bringing that home. And so we're having conversations like this in the community about how we can address these challenges. I think that for those who are worried about how the international conference is going to go, I say I'm not too worried because the local conversations are what matter more. And that's at least inspired people to take further action if they know that we're not taking it at the top. So I guess we'll leave it at that. Thank you.
Thank you. Can all the panelists join us up front? Yeah. Thank you. I always love hearing what our students are doing around the world to make sure their voices are heard. I have a question. Are we talking enough in view of things like island nations disappearing right now? Are we talking enough about climate change as a global human rights issue?
That's a big question. And I think one of the things that really stands out from this panel is, for me, is the importance of thinking about these global issues from a wide range of different perspectives. We can think about this in terms of development. We can think about this in terms of humanitarian responses, public health, international diplomacy. We really need to be using all of the tools in our toolbox to be tackling this from all different angles. And I think a human rights perspective is absolutely a critical component of that. I think if we start thinking about what building that adaptive capacity, addressing vulnerabilities, as Erin talked about, this is about ensuring that these processes are reducing inequality. And I think ultimately that's a human rights-based approach.
I would say that we're not. And I think that fundamentally one of the challenges is that we don't talk about human rights enough in public, right? I think one of the teachable moments is currently thinking about the coronavirus and quarantines. And so from a public health perspective, we're beginning to think about sort of this extreme case of infringement on human rights. But as a country, because we haven't been signatories and we haven't ratified a lot of the UN documents on human rights, it's not part of our culture to think about these issues. So for me, I think it's really incumbent on these collaborations and these partnerships to help raise these issues and raise it as a frame for discussing many of the contemporary issues, because we're always going to be competing with what's in the headline, but most often a lot of what's in the headlines has a human rights component to it. So I would say that's where we need to start, at least.
And one more for our students before we open it up. Given the amount of time you have put into thinking about this topic and the effort you made to go to COP and everything, what are you thinking from your generation's perspective are where you'd like to see more of your age peers putting their efforts and their energy, not necessarily just in terms of activism, but also in terms of career choices or pathways forward that you can see your generation making a difference?
Thank you. That's a really great question. I think my first takeaway is that, at least I've seen over the past few years, that it does not matter what industry you're going into, that addressing the threats of climate change, addressing adaptation, all the things we've talked about have permeated and found their way into every industry. And I think that leads me to understand more the value of education and the importance of education, not just schooling and university, but local education, learning in your community. That level of understanding, I think, is a bit not pressed enough at our level in the city of Boston or in the state or in the country and globally. And I think that without that level of education, we're reducing each and every one of our ability to use our industry for good, whether we're going into finance or whether we're going into any sort of industry that you might think is not going to touch climate change. There is a way that it is touching that. And if you have a mindset, not even activist, but just oriented towards doing good and understanding sustainability, it changes how you do your job. It changes how you are able to act and work and help your community. So I think that level of education really shapes what we're able to do.
And also just to point out some things that I've been seeing already that are really encouraging in terms of youth participation. At COP, there's a group called Youngo, and they meet every single morning. They discuss their plan for the week about what negotiations they're going to attend, what side events they're going to do. And I think the presence of Youngo at COP really keeps the negotiators on their toes. I think there are a lot of sit-ins and protests, and it keeps the energy of COP ambitious, and sometimes I feel like all the negotiators in the countries get kind of bogged down with the logistics, and I think the presence of youth at COP makes it much more motivated.
We have questions in the audience.
Yeah, hi, I'll go first. Hi, my name is Aksha. I'm a fourth-year student here at Northeastern. So I wanted to ask a question that was sort of in a similar line to what Ava and Keyon were talking about, in just terms of what you saw when you were at COP on sort of the efficacy of protest movements. So my mind thinks to the flashpoint of last year, we looked at the Extinction Rebellion protests that were happening around the world, and those were certainly divisive. Like, certainly there are some groups of society that view them as more disruptive and didn't really hear what they have to say. It might have weakened the legitimacy of the climate movement, while on the other hand, they might have also been getting into the thoughts and minds of peoples and places of power. So in terms of what you saw, how would you rate the efficacy of that and how it goes moving forward as well?
I mean, I think it keeps, like I talked about, the energy and the momentum going. I think, although ultimately not much was done at this COP. Also, I think this was different this year compared to other years, but the protesters at one point the second week were kicked out of the conference, which made headlines and was really unorthodox for these negotiations. So I think, I don't know if that's points to maybe they're making a little bit too much trouble, but I think that means that they're being more effective. They seem to be more of a threat. So, I mean, in terms of actual action, in terms of what was decided, I'm not sure at this COP, but I think that it's pushing the movement forward. I'm not sure.
Yeah, I just add that I think that the youth at COP, especially, this is, in my opinion, the most active people in every country. They're sending people who have worked for years on this issue. Even if you say youth, I'm talking like 10 to be 24 up to 30. These are people who are already working on the issues, and I think they're very, very smart and tactical. And so when the audience is the media, when the audience is the press at the conference and the outside community, they're staging sit-ins, they're staging die-ins. They lie on the floor to reflect the problems that are happening, and you're speaking to a certain audience. But I think that they've also developed, I guess us included, but all those at the conference have developed an understanding of when to approach the other audience, which is the negotiators and the people who you're trying to push the lever at. It's like if you get a meeting with the mayor or you have some sort of lever to push. I think then they're having constructive meetings and they're having one-on-ones, and that's where Youngo and other youth groups have also been able to get those quality time moments to push leaders to act. So depending on the audience, I think that they've used the movements effectively, and at least in my opinion, it hasn't delegitimized the movement because it's founded upon activism and just urgency. But I think that what you don't see sometimes and what happens at the conference is very tactical, very smart advances made by youth.
A comment and then my question. For those of us who are in my age range, the Paris peace talks for the Vietnam War, I forget how many weeks we took just to figure out the shape and size of the table at the talks, but it was a lot more than figuring out what we were going to call the meeting tomorrow. My question is, this question about the Greta Thunberg, whether she was tokenized. And in terms of leadership and cutting through the fog of so many different diluting, not perspectives, but interests, okay? Industry doesn't want to cut their emissions. We want the economies to grow. The issue of whether people are willing to make sacrifices in terms of their economic well-being to further the good of the entire planet. So my question is there a way to take, I think was Dr. Mohammed's presentation, talked about day zero, where you focus on a goal and you make it personal. Is there a way to communicate that? And I think Greta was trying to do that, but I'd be interested in other perspectives about, who's the Martin Luther King of this? Who's the voice? Who's the leader that's going to cut through the fog of all the interests and the self-interests?
Yeah, so I was the one who brought up day zero. I do think there are some really interesting psychological studies about what motivates people, right? What gets your attention and what translates your risk perception, so people perceiving climate change as a risk, into actual behavior change. And that's a very interesting, I would say, an interesting disconnect that we see sometimes. And so certainly, I think there are a lot of different ways that this can happen. I mean, one way is to make it personal. That is absolutely backed up by tons and tons of research that, humans seeing other humans doing things makes it more real, or humans seeing other humans being affected. So this is also partly why, when I mentioned the day zero, we did a study with a bunch of scientists around the world to look at the climate to say, did climate change impact this event? And I mean, you could do that study for any particular climate variable anywhere, but we picked that event because if you make that statement to an event that people know and they can see it and they understand how painful that was, they can start to say, okay, what does this mean for us? What does adaptation look like? So we do use extreme events to help people understand what could the future climate look like and how are our risks different. That doesn't work in places that haven't experienced an extreme event, of course, but I think Boston learned from New York City's experience of Hurricane Sandy. Even though we didn't have Hurricane Sandy, we could see what was happening there and make changes in our lives. So absolutely that personal affect is critical. There are a number of other ways of trying to motivate behavior, making things memorable. I think protest movements have a lot of they do a lot of things really well in terms of making things memorable. So we actually have started to do flash mobs about heat waves in different cities in India to try to get, the flash mob is people literally like dancing and singing in a public place about what you need to do if there was a heat wave. And what we found is that we did get really good retention by the people who saw the flash mob of the actions that we wanted them to do. We did not eventually measure did they do them when a heat wave happened later, which would be the ultimate test of whether or not our flash mob was a good choice. But making things memorable, I think, is critical, and using these types of tactics is important. If we're just talking numbers all the time, we're not going to get anywhere. I don't know if other people have comments on this.
I think one thing that comes to mind is this idea of collaborative efforts, and particularly in this day and age, it looks different. The world looks much different than it did in Martin Luther King's time, and yet if you look at what his skill set was, right, and you think about how that matched with his time, then what is it that matches with our time? How do we take advantage of social media? How do we build collaborative efforts across the country, across the world? And I think that that's one area where we're not so good about talking and having conversations with people we don't agree with. And so I think that's a huge opportunity to develop collaborative efforts. And when we look at the success of coalitions and previous past social movements, that's an area where I think we really need to put some attention to. So, for example, thinking about how do we create, I'm familiar with Physicians for Social Responsibility, originally really focused on the prevention of nuclear war, but they have recently, or not so recently, but they have picked up climate change as one of their key areas. And so how do we bring together these partners across disciplines and across generations? I think that there's an awful lot of opportunities, and across political parties, right? Going to this point of when we see that we are potentially at risk. So whether it's ash from fires in the Pacific Northwest and California that we actually can detect that we're all being exposed to that's impacting our health here in Boston, then maybe it doesn't matter if we're Democrat, Republican, et cetera. We're all at risk. Let's begin to work together. So I'm all for figuring out how do we craft language to talk across these differences. And I think that's where we need to put a fair amount of effort.
Yeah, and just to tag team a little bit off that emotional connection, how that gets people to care. I think this was one of our earlier panels in the semester talked about how this image of the polar bear on the last little piece of ice in Antarctica wasn't doing it for people to like get motivated about climate change and see how it was going to affect them. And I think that is part of the reason why Greta has really risen to this type of prominence. She calls out and she says, "How dare you take away my childhood?" And how do you look at her? I mean, she's 16, but she looks really young. And how do you look at her? She's like, "How do you take away my childhood?" Like, oh my gosh, like, I don't know. How does that not touch people? And I think that's why she's become such an icon of the movement. I think along with that, it's a little bit unfortunate that some other young activists like her who've been maybe working at it a lot longer, but some young activists of color have not risen to the same level of prominence as Greta. Oftentimes, I don't know if you saw the headline, but it was Greta and a couple other activists, and they cut out like the last person who was this young woman of color as well. And I just think should the movement be led by this like young girl from Sweden who's barely, privileged in terms of the world? And I just think it's interesting who are the icons that rise to the level of everyone knowing them.
Hi, I have a question that's actually bothering me a lot, so I would be very interested in listening your opinion. So when we think that all the many poor countries are actually getting richer, people here have more opportunities, so they start to consume more, they start having access to air conditioning, to fridge, and all this kind of thing. So how do you think can we balance out people that are actually finally starting to have a chance to feel this like what we now think as basic needs for us here in the developed world, and the impact on the level of emissions, of the increase of these emissions that all these things are going to have? Thanks.
I can at least start this conversation. It's obviously a huge question. And for me, this really is one of the questions that ties this panel together and connects the question of the international negotiations to some of these more on-the-ground initiatives, in that it's absolutely true that we cannot have development that looks like historical patterns of development in North America or Europe for the rest of the world if we want to achieve any semblance of addressing climate change. But we obviously have to have development pathways for the rest of the world. And so I think we have to think a lot about what does collaboration and coordination among different countries and sharing of both technologies and finance and knowledge to help countries leapfrog to cleaner, more sustainable pathways of development. And it is going to take a lot of, I think, very difficult decisions
about what isn't going to be possible as well.
I think this is also where the notion of just transition comes in. Just transition doesn't imply that we know what a just transition is, but that it has got to be foremost in our mind as we're thinking about solutions, so that we're not locking in place some kind of status quo and are lowering emissions, but we're also leaving people where they happen to be now. And all of those maps that show so much inequity are frozen in place. And I think it speaks to the importance of what are the values that we're bringing to these negotiations, to who we're recognizing as activists, that we are recognizing Indigenous people's voices, we are recognizing voices of color, we're recognizing voices of the Global South, and ensuring that they are at these tables where these critical conversations are happening.
Just to add a really small point to that too, because I was really inspired by your comment. I just want to elevate a comment or a conversation that happens at the conference that's a bit marginalized, that's often by island states, that's really important, and maybe it ties to your point, which is decoupling our existing view that GDP growth is the same as development. And that's kind of what's happening with sustainable development and the SDGs. Very happy to see that a lot of countries now are reorienting how they're developing towards a sustainable approach, whether or not they are previously a developed nation or they're achieving, what you're calling for, getting close to that new stage. But a takeaway is that advancing in human development, I know Costa Rica is very popular with this, but advancing in human development is an idea that doesn't get enough attention and that hopefully could change the conversation. And I saw that happen at the conference, and I saw that happen actually for a number of years, but most recently this year. So I'm optimistic that when we do decouple that assumption that your development means your GDP is growing and that you just have more goods, even to be able to afford developing countries and the people there with those opportunities still won't come at the cost of harming the environment if we do approach it from a more human development standpoint and a more holistic view.
Hi, thank you all for being here this evening. My question is about a sense of hope and faith in kind of these international negotiations. So I was at the negotiations as well. I was there during the second week, and I was there when the protesters were kicked out. It was really emotional. It was one of the most peaceful protests I've ever seen. There was music and singing, and people were just kind of sitting on the ground. And then these big UN security people literally kicked them outside. And I think after that, there was a really big sense of distrust in the institution and in the organization, the COP leadership. So I'm just curious, given that very little progress was made and given how people who were demanding progress were treated, what do you think the future of COP negotiations look like?
I don't know. So, as background to your question, I study forecasting and our ability as humans to forecast behavior out of 6 months in advance and really predict kind of anything that's going to happen to the economy or politics or whatever is not very good. So I don't know. This is total caveat to anything I'm going to say. I think there was some excitement about the UK hosting, that there have been some news articles that have maybe made people retract some of their excitement recently, about just things just not really kind of moving very fast. Let's say that in terms of preparations and all these things. I think there is some hope this year that this can move forward. I think what is particularly interesting about the Paris Agreement is that because the nationally determined contributions they're written by countries. So the country says, I will do this. You have a name and shame ability that we didn't have before. So whether or not anything happens in the COP, we do have the ability as society to say, hello, country X, you pledged that you would do this thing, which, okay, we agree maybe wasn't enough, but are you doing it or are you not doing it? And are you meeting your own pledged objectives? And that's something that that naming and shaming can happen outside of the COP and is one of, I think, the kind of more interesting pieces of how the Paris Agreement was set up. Will that happen? We'll see. So one of the big things on the agenda coming up is this global stock take. We don't entirely know how this will look. We don't entirely know how we're going to take stock, but that is the moment where we're supposed to be starting to name and shame. So I'm interested to see what will happen. There are definitely a lot of people, my team included, you heard from Pablo last week, who is constantly coming up with ways of disrupting the entire negotiations. But in terms of not disrupting in a conventional sense, but saying, could we have a different mechanism for having conversations, right? That isn't the traditional way of sitting around and blocking each other, but are there ways of introducing other types of facilitation, other types of ways of having conversation, potentially even a little bit outside of the formal negotiations? And so we do host a climate and development days every year at the COP that has really weird stuff, but where people have that opportunity to have a conversation that isn't so formal and tries to elicit deeper change. Those are my efforts to offer hope. I don't think I can predict the future, and there could be something really wild out there, like a black swan event that we have no idea that could change the shape of this. And I think so. My ability to forecast is low. Other thoughts? I don't know.
Working in the space of adaptation, I get asked a lot, isn't this so depressing to work on climate change every day? How do you stay motivated? And for me, working particularly on adaptation is really actually a very hopeful space to be in, because it's about envisioning a different future for development and recognizing that by addressing climate change, we're often addressing not just climate impacts, but the whole underlying drivers of vulnerability and inequality that have been existing for a long time. And so in that light, I think I also don't have a good answer to you of what will happen at COP, but so much of what needs to be done and is happening in the climate space is happening regardless of what's happening at COP. We're seeing both in terms of mitigation and climate action on kind of the emission side, but also in terms of mainstreaming climate considerations into development pathways. I think this is really something that countries and organizations are doing out of their own self-interest, of that this is what good development is going to look like. And so I think there's tons of resources, tons of opportunities that are increasingly being mobilized to address this challenge that are much, much broader than just the climate negotiations.
We have one more question before we wrap it up back there.
All right. I attribute a lot of our kind of effects on the planet based on our exploitative nature of our work, our lifestyles, our conveniences. A lot of our comforts can be exploitative way down the line. We're thinking like our fashion, our foods. They're kind of difficult to keep up with. And I know these problems are complex. We have the economy, nature, health, our communities. And I'm wondering if an aggressive world rehabilitation, Green New Deal, whatever mobilization effort we can join up in and participate in, it's going to need to be aggressive. We have a short, the effects are being seen now. And I think that's an aggressive kind of Green New Deal type scenario. Does that mean an aggressive kind of economic inequality of bringing that together? And do you think that will make things worse? Maybe it's not related, or will it improve our ability to kind of meet some of our environmental challenges. So I guess to sum it up, if we had an aggressive like income inequality type of program, is that going to make us a more resilient to climate change, or perhaps maybe less resilient to climate change? And if it's a weird question, you can also just say that.
I'll start off, and I don't think I'll answer your full question, but the piece of that really stood out to me is the conversation that I'm increasingly seeing in the adaptation space about the need for transformational adaptation strategies, recognizing that kind of small incremental changes aren't going to get us to a future that we need. And I think in some ways this is really an exciting conversation and kind of a process of envisioning a future that's much broader and bolder than anything that we could possibly have imagined before. But I also think that we have to be somewhat cautious in the way that we approach understanding what transformation and transformational change might mean, to make sure that we're not, in our urgency to recognize the urgency of the problem and the need for action, that we are paying attention to the process at the same time. And again, going back to this theme of making sure that the most vulnerable are not left behind. One of the ways that I see this often translated is to try and move as quickly as possible at the largest scale of change possible. And sometimes that means having interventions or working with not the most vulnerable people, because it's going to be the hardest and the slowest to sometimes make big changes for those that need it the most. And so I think we have to balance the need for urgency with the need to pay attention to the most vulnerable.
And I think that comes back to one of the major themes of our course, which is how essential it is to balance our ability to wrap our heads around complex problems and the systems that are involved with these while maintaining an ethical lens. And while it's hard to see all of the things that we have to be tending to, it also means that each one of those is an opportunity. It's a lever for change. It's a lever for heroes to stand up, because it's not going to be one person. It can't be just Greta. It can't be even all of the young people who are already active. It has to be people joining movements. It has to be financiers standing up. It has to be physicians standing up, like they did with International Physicians for the Prevention of Nuclear War. And so I think that is where the room for creativity and the room for excitement comes from, because everybody in this room can be one of these heroes who stands up in their own space and in their own field and keeps us moving. And so with that, let's take our moment and this week think about how each of us is going to be a hero in this scenario. Thank you, speakers. Thank you, audience here and online. I will see you in a couple of weeks, and I hope you have a great panel next week. We'll be talking about migration and refugees.